Hey, this is Dr. Yang, the inventor of the PSC Nasal Filter. I was actually in the cafeteria of the Forest General Hospital at Harrisburg, Mississippi. I'm waiting to pick up one student. He was doing a treatment, and unfortunately, he will need to conduct a bone marrow transplant. So there'll be a long treatment and recovery journey for him to go through. But anyway, I'm here and I just want to share about the PSC nasal filter that how the nasal filter can utilize for the hospital setting. Like in the hospital, the AC system usually, typically, is quite be good. They filter the air pretty good. I have a meter. That meter reading the air particle in this cafeteria is around 4 AQR, the 4. So the particle count around 100 particle per liter. That is extremely low. You consider, some outdoor air quality can be about 100. So their particle count can be around, 10,000 per liter. So basically, every breathing, you breathe in 10,000 particles. For here right now, we only have around 100 particles. It's really low. So regarding the particle count in the hospital setting, that's not a main concern. So you are not concerned about because the air quality, because toxic particle, small particle, influence your health. So that's the hospital did a great job. They maintain, they make sure the quality is high, and so no concern. And even you walk uh, any hospital or setting, you will find a sign. It said smoking is prohibited, absolutely, right? So any violate, you can be processed. So any thing cause toxic particle or pollution is rejected. So, so what is how the PSC nasal filter be used to protect for the hospital setting? And the hospital, especially into some seasonal or some special event like pandemic or a flu season. So by that time, the virus or the strains of the virus become the main concern, and so that's the main threat. So we talk about some threat. It can be invisible. The virus is all invisible, and small particles, toxic particle, invisible. So in hospital, you are more concerned about the virus because that's a hotbed for the virus because the patient come in, any kind of patient come in, so you cannot reject it. You must treat all the patient in the time. So that's why in the hospital and even the hospital do the circulation, doing things, but it's common sense. There are chances that the virus can be in the air circulating. So in that situation, and I think have a measure of the protection that'll be really good. That's why in the COVID time, the hospital, all the medicals, the doctors, and the nurses all wear a mask and wear N95 mask. It's seal well, really can filter any air they breathe in, so it can block a majority, like a 90% or 97% of the virus from them, so that it keep them protected. So when they serving the patient, when they treat the patient, when they protect the patient, they can be protected because whenever a nursing come down, so there are several patients waiting. She cannot take care. And this kind of specialty knowledge or the expertise skill and no other people can replacement. So that's a big loss for the patient, for the hospital, and also for the community. So we got to be protect our protectors, protect our nursing, protect our doctors. So in the situation that they can be healthy, they keep being strong, so they can protect us. So that's somebody's calling me. I'm not taking a phone call right now. So that's why the PSC nasal filter can play a role. So the PSC nasal filter can basically, whenever we use N95 grade filter, so they protect the N95 level of the protection if the user practice breathing through the nose. So so the nasal filter, you can wear the nasal filter all the time. And when you go to the cafeteria, like what I see right now, when you're eating, when you go to take a coffee, so you can always have the nasal filter. And you're mindful to breathe in through your nose, so that be you're protected. Any antigen in the air, there'll be a filter out, like N95. And the nasal filter use a medical adhesive, so it's a chill 100% air sealing. So compared with the regular medical mask, this filtration and protection is more than 10 times more protection for that. And another benefit of the nasal filter is it really helps the mask wearing. For any mask wearing, you have a lot of disadvantage about the mask is always on your mouth, on your nose, so it's hard breathing, and also you get strains, so that it can form a pressure in your face, pressure on your ear. So I know that any pressure on the head, it can cause a stress. And so this nasal filter will eliminate all of the other things. And what is a more even better thing about the nasal filter is when you wear this nasal filter under the regular face mask, you actually feel more comfortable. So it's a little bit counterintuitive about how that works. You put one more layer, how can I be more comfortable? I think the reason is the nasal filter, it can dissipate the air. So the air can be very gently dissipated, so you don't have a big rush exhale. It's a moist, hot on your face. So you basically barely feel anything on your face. So really is make the wearing lots more comfortable. You can wear this one under regular face mask, or you can wear this under the N95 mask. So it's comparable to when you wear a pants. People usually wear underpants, so that you feel much more comfortable when you wear underpants than wear the pants. So that's the related the concept. So okay, yeah, that's it. I go to different working environment and just think about how the PSC nasal filter can utilize it to protection. So that's for the hospital. And I've been in the hospital for many more time, and I always think this nasal filter will be a layer of protection for all the doctor, nurses. So we need to protect them. We need to protect them really well, because in the time when they're down, nobody take care of the patients. As we said again, they need a specialty skill. Nobody can replace them. So you gotta protect them. In the pandemic, they become, I would say, a national treasure. So you gotta protect them very well. So that's why one of the PSC nasal filter will be step up on the position to be a guard, protection for all the medical professionals, protect their lung, protect the body health, and also earn them good timing, good rest, so they can come back quick, rest well quick, don't get sick, and they can protect the public. All right, thank you very much. Again, this is Dr. Yang, the inventor of the PSC nasal filter. We are located in Hattiesburg, Mississippi, and we advocate healthy breathing and breathing fresh air free from the antigens, from the toxic particles, so we can breathe safe, we can breathe in clean, and we breathe in comfortable. All right, thank you.